addressing coronavirus and pretty much everything that has happened this year, both leading up to what we're seeing here in the United States now, mid-March, and what will happen in the future based on a paper that I found to be really interesting and helpful from Imperial College London that was released yesterday. So I have a timeline of key events that I want to go over and talk about in like a big global scale, and then talk about some of the concerns that we're seeing in the United States. And I hope this helps as a summary or clarification on why people are behaving the way they are, why the governments are reacting in the way they are, and then hopefully give you a little piece with what we think is going to happen in the next 6 months to a year. So let's start in 2019, which felt like so long ago. On December 31st of 2019, China found a case of pneumonia that could be traced back to a city called Wuhan, China. And this wasn't really a case for concern, since there are a lot of things that cause respiratory illnesses. But in early January 5th, they found that it was not SARS or MERS. Both are illnesses that we have dealt with in the past, viruses that have caused a similar epidemic in the past. So the WHO was concerned. They know that this is something new, which they named 2019 UNCOV at the time for new coronavirus. And studies show that this is a strain of coronavirus, which is not uncommon. And I think this is one of the big things that people try to emphasize, is that the coronavirus is just like the flu. And scientifically, it is. The flu is a kind of coronavirus, except this one doesn't really behave like the flu. One of the reasons why the flu is so accepted in the United States, I think is a good word for it, is because over time there tends to be herd immunity that is built up from every flu season. So when you get the vaccines, they protect you, and the vaccines are not 100% accurate, but they have a pretty good mix of what the health organizations think is going to be in this flu season. So it's a mixture of a bunch of different viruses. And there is also immunity built up from season to season. So if you get the flu one year, you're unlikely to get it again in the same year or again the next year. So you kind of have a length of immunity that you've built up once you've contracted the flu. So the flu is really well spread in the United States, but we know a lot about it. We have measures that prevent the spread of the flu, and then it also is not as deadly because we have these countermeasures already in place. In mid-January, we see a first case outside of China in Japan. And then around that same time, we saw the first death in China was a 61-year-old man who contracted the flu from that city, from the market it originated in. By late January 21st, we saw the first case in the United States in Seattle, Washington, in the nursing home, which was hit pretty hard since there was a lot of older people there, and we know that people who are above the age of 70 are a lot more likely to die from the virus. By the end of January, the WHO declared it as what they call a PHEIC, which is a public health emergency of international concern. So by this point, it's been to a lot of countries. It's been to South Korea, the Philippines, the US, Europe, France, and Italy, Iran, and there is a general sense of awareness of this virus. Although I would say in the US, there is not panic yet. There was the first case in Seattle, but at least where I live in Colorado, we didn't think things were going to get this bad. this quickly. So in early February, we see a first death outside of China in the Philippines. On February 11th, the WHO named this virus the COVID-19. That stands for Coronavirus Disease 2019. Then we see the virus hit Italy pretty hard. By late February, northern Italy was on lockdown, and then by early March, the whole country is on lockdown. So that means you don't go outside unless it's for an essential reason. You're going to a hospital or you're going to get groceries. Everyone is quarantined inside, and it's essentially what we're seeing here now, but on a much, much bigger scale. You could be seriously fined and punished if you're caught outside without a valid reason. That kind of brings us to where we are now. A couple days ago, on the 11th of March, the WHO declared this as a pandemic, and that means this is a global spread of a new virus. On the same day, we see a Europe travel ban from our administration in the US, and we see increased testing in airports in Chicago O'Hare, where people waited for 7 hours to come back into the country because they were standing in lines to get tested. And nationwide, we're seeing, throughout March, states of emergency declared in various states. What a state of emergency means is that each state has an emergency fund that they can tap into that's essentially replenished every fiscal year if it's being depleted. So by declaring a state of emergency, the state has the authority to pull from that fund. So this doesn't really affect the citizens day to day, but it does mean that the government is taking this seriously enough to tap into that emergency fund. So after Washington, we see many more states, including California, Florida, New York, have confirmed cases, and now New York is the state with the most confirmed cases. It surpassed Washington about maybe 5 days ago. And we also see that New York, if it were a country, it would be the 11th on the list for the number of confirmed cases. So things are pretty bad in the US. This triggered a lot of panic in the general population. We see panic buying all over the states. We see grocery stores being cleared out of essential goods. We also see schools around the country close, some indefinitely and some just for a couple weeks, and then by then they'll reevaluate and see if things are better. But they're either moving the students out of the dorms and back home, or moving online, or in some cases maybe both. Everywhere in the country, people are being affected right now pretty drastically, and from what I can see, there tends to be two camps of people that rise out from the situation. On the extreme sides, of course, there's people in the middle, which I think is where we all need to be. But there's one extreme to where they think this is just the flu, it's not that serious, I'm still gonna go to spring break, I'm still gonna have fun with my friends. And we see the beaches of Florida, which is a popular spring break destination, we see that they're still packed. Disneyland is still packed with people, and the students there, mostly students, since they're going for their break, are saying, if this is the end of the world, I want to have fun, or we've planned this for 3 months, I just want to have fun when I'm here. And that is one extreme, which I think is very irresponsible, and we can talk about what that effect is on the general public. So let's talk about what we think is going to happen in the next 6 months. And these are really big ifs. No one knows what's going to happen because we can't model the human population as much as we try to. There are things in people, responses from populations and societies that we just can't predict. So this is our best guess at what's going to happen in the next foreseeable future, I should say. So last night, I was reading this paper that was published by Imperial College London that studied what they call MPIs in Great Britain and in the US. So, what MPIs are non-pharmaceutical interventions. And this is the only strategy that we have right now because, like I said, we don't have vaccines. So, there are no pharmaceuticals that can help us. So, all we have are MPIs. Two fundamental strategies were outlined in this paper. One is called mitigation, and one is called suppression. So we'll explain both. But first, let's look at what happens if we don't do anything. If we just treat this as the common flu. I mean, the flu kills a bunch of people every year in the US too, and we really don't do anything about it except for vaccines, but we don't do what we're doing now, which is the social distancing, the shutdowns. So if we don't do anything, 2.2 million people in the US will die. Obviously, we don't want that to happen, which is why we're seeing the government respond in the way they do now. So let's look at what these strategies mean. Let's look at mitigation. This is essentially what the US response has been in cases like this before, where we tried to slow down the transmission and its impact on the healthcare system. For instance, vaccines during 1918 were made available to those who had pre-existing conditions, to those who would be more likely to die if they got the virus. And as a result, there is a general population immunity that is built up over time. And then the other method that we can take is suppression. So this one aims to reduce R below 1. So R, this number they call in pandemic modeling, is called the reproduction number, which is the number of cases that are generated from one case. So if you got it, how many people you could spread it to, or how many people on average gets it from someone else. So right now, they're estimating R to be around 2.4, which means for every person that is infected, they're going to infect about 2 to 3 other people. The key difference between these strategies is that in suppression, you're reducing R below 1, and in mitigation, you're reducing R but not necessarily below 1. And we'll see the impacts of both of these cases. So you saw what would happen if we did nothing. The 2.2 million people, you can see that the cases infected is like a curve. It's like a bell curve. So we're in the stage where we're seeing that exponential growth right now. It's going to hit a peak and then it's going to come back down. In the case of mitigation, what would happen if we implemented these strategies for 3 months? And what we can see here in the figure is that they have different methods of mitigation. One is case isolation. So when you get a case, you isolate yourself either in the hospital. One strategy is case isolation, which means when you have a case, then you're isolated in a hospital, you're confined, you won't spread it to anyone else. That is the most effective way to reduce spread. Home quarantining, you still have that home spread factor within the household. And then we can see that they are implementing strategies together. So case isolation and household quarantine. What does that look like? Closing schools and universities. What does that look like? They found that the best combination of the strategies was to do case isolation, home quarantine, and social isolation for people who are older than 70 years old. So we could see that the curve is flattened drastically. And this is what, when you hear people say flatten the curve, this is what they mean. It means that our healthcare system has a certain capacity, and right now, at the trend we're going to hit that really quickly. And for the majority of the outbreak, we are going to be exceeding that. So by flattening the curve, we reduce the burden on our healthcare system. We can see when you flatten the curve, a lot less people die. And that's essentially what we're trying to do. By implementing this set of mitigation strategies, we would cut down the number of infected cases to 2/3 of what it would be, and then half the deaths. So that still leaves us with 1.1 million deaths in the US, which personally I don't think is good enough. And this paper didn't think it was good enough either, because they didn't recommend mitigation as a strategy. They said by early April, we would exceed the number of hospital beds in the intensive care unit. This paper really recommends suppression, which again is reducing that reproduction number to below 1. So either you infect 0 people or you infect one, hopefully you infect less than one person on average. So in this strategy, we can see that if we implemented these suppression strategies for 5 months, then we can stay below that surge capacity for the hospital beds. And we can zoom in on this graph and we can see that when these two sets of strategies are implemented, different things happen, of course. So the orange line is case isolation, household quarantine, and general social distancing, just those 3. The green line, which looks a lot more optimal, is school and university closure, case isolation, and general social distancing. So that is the approach that we need to take. Since mitigation is not viable, 1.1 million people are still going to die. The only viable way is suppression, and then within that, the only viable way is that green curve. So we see that school and universities should be closing, and it's good because they are. Case isolation should be happening, and that is what we're lacking on. Our healthcare system is just overwhelmed even now, and we are not testing the right people. We are not isolating the people who we need to be isolating. So that is definitely a flaw that we need to be fixing if we want to follow this trend. And then general social distancing. So the CDC, Center for Disease Control, released recommendations that there should not be gatherings of over 10 people. Even then, everyone should be practicing social distancing, and that means not seeing anyone else. If you're not a part of the same family, if you're not in the same household, you should be not interacting with other households. So we see that there's a sharp peak around November of 2020 if we follow this suppression case. And this is the downside of suppression, because we don't have a herd immunity built up. Because we are isolating and because R is less than 1, that means people are not getting the coronavirus, which is good. But then the more effective we are at this suppression strategy, the harder it's going to hit later on in the year. So this is not the end-all solution. There is no way that we can practice these sets of suppression strategies for 5 months and then just go back to life like it is. Because once we loosen the protocols, we don't have immunity built up. So when everyone goes out and socializes again, we're going to see that same exponential curve. It's going to be just like what we're seeing right now, repeated. So the idea is that if we can keep the curve down to where our healthcare system is not overwhelmed and do that for long enough of a time, by then we hopefully have a vaccine and we hopefully have different strategies that we can implement besides NPIs. So this is the only thing we can do right now. I'm not saying this is going to be the perfect solution. It isn't. And it is not the perfect model of what's going to happen. Even if we do these things, there is still a likelihood that we could overburden the ICU. there is still a likelihood that we could have more people die than what's showing on this graph. But with the science available, with the data available, this is our best guess at what's going to happen in the next 5 months. If you're one of the people who think that this doesn't apply to you, that you're going to be okay because you feel fine and you want to have fun, in Italy right now, when younger people, 23, 24-year-olds, get sick and they have to go to the hospital, the first person they take off the ventilator is an 80-year-old. And they give that ventilator to the 23-year-old because they have a better chance of surviving. So, personally, I don't ever want to come to the situation where I am indirectly responsible for someone's death because people around me was reckless, because I was reckless. To be in that situation where younger people are being prioritized over older ones, and then when you show up to the ICU, you're taking that opportunity to live away from someone else. I never want to be in that situation, knowing that I could have prevented this, I could have done more, and I hope that this has shown you that it's always better to be cautious than to regret not having been cautious in the first place. And I know this is a sad note to end on, and seeing these deaths even in graphs and in numbers makes me really sad and really scared. But it's important to remember that there are people whose sole jobs are to fight this for everyone. And think about the doctors and the nurses in hospitals and the people who are on the front lines, the grocery workers, the people who are taking out the trash for you. These people are in contact with the virus directly and risking their lives so that we can sit at home and practice social distancing. And I think that is the bare minimum that we could be doing. I am so grateful to be in a situation where the only thing I have to do is to stay at home. And I think you should be too. I can't imagine what the healthcare workers must be going through. I applaud all of you out there. Please, if you know people who are struggling, if you have either money to give, if you have a meal to give, this would be the time to check in on your neighbors, check in on your loved ones via phone. Don't go to their house unless they are elder or they are immunocompromised or disabled to where they need you to physically be there. Otherwise, you're putting them at risk. So stay safe, stay sane, stay practical and scientific always. There are a lot of misinformation, a lot of fake news about what you should be doing or supposed cures to the coronavirus. Don't be hoarding toilet paper. Don't believe everything you see on the media. I would say the CDC, the WHO websites are your best bets. Accredited news organizations that report independent research like this, that is not biased. So I would still be cautious if even news organizations that you trust. Just be wary. I don't mean that you can't listen to them, but just be wary. I'd say for me, reading as much as I can is the best way that I feel sane throughout all of this. And I know for other people that's not the case. So do what's best for you. Try to stay informed, at least locally, about what's going on. So you know not to go to certain bars or restaurants because they're being closed down. And try to check in on as many people as you can over the phone because we all need it right now. I've been trying to check in with a friend every day that I don't normally talk to, and it's been really nice. I hope this has been helpful in giving you an overview of what the coronavirus is, what has been happening around the world in the last 3 months, why people are reacting the way they are, including governments, and then what we should all be doing in order to curb the number of deaths and the number of infected cases over the next 6 months. So, stay safe, everyone.